I'm joined today by Alanna Shaikh. Alanna is based in Sri Lanka. She's a principal at Global Tomorrow. She's a global health consultant, and I'm going to ask her what she thinks the future of global health as a practice might look like in the world created by COVID.
I've been thinking a lot about global health and what COVID-19 has illustrated about the discipline and the practice of global health. Because obviously the actual health impact of COVID around the world is going to be massive, catastrophic. I mean, millions of people are going to die or suffer long-term disability just because of the knock-on effects of COVID, because of things like losing access to healthcare, let alone the people who are actually dying or being disabled by the virus. And I think it's going to take a long time to unpack the length of that damage. And something that I've been thinking about in the shorter term is, what does this mean in terms of the way that we actually do global health as a discipline, of the sector or the industry that is global health? And I think it's really pointed out how colonial global health has been. This idea that knowledge and skill comes from countries with more money and ignorance comes from countries with less money. And you see it in a lot of directions. You see it in what they're calling parachute science, where the principal investigator comes from a wealthy country, flies in and out of a country with less money, and the real work is being done by the researchers on the ground in the lower income country. And then you also see it when you look at donor-funded programming, when you look at global health interventions, that we see country managers and different kinds of managers coming from the wealthy world to supervise teams of host country nationals. So now we have COVID, right? And we've got travel restrictions, we've got lockdowns, and we can't be flying all these expats around anymore. What happens to global health interventions when all the expatriate country managers have to go home? It turns out not that much. It turns out that these people were mainly in charge of writing reports in good quality English so the donor could read it and feel satisfied.
What might have been different had we done global health differently?
Well, if we'd been doing things really differently from the beginning, we would have been thinking with global health equity from the beginning, and the COVID pandemic wouldn't have reached the point that it's reached. That countries would have been better prepared to put a stop to it. I mean, I say that, but it turns out that the higher income countries are getting slammed by COVID just as hard as lower income countries. So that might not actually be true at all. I mean, West Africa is doing vastly better with COVID than anyone could have anticipated. On the other hand, Italy went to pieces. So I guess I'm saying I don't know. I don't know what it would be like if we'd done things differently.
Help us think through the global versus local in health. At the one end, the pandemic seems to be the most global thing we've ever seen. At another, it seems like the most local.
For all infectious diseases, there is a balance between the global aspects and the, in fact, hyper-local aspects. Because you need to know the disease is coming, you need the warning signs, and you need to learn from the experience in other locations before it comes to you. That is, broadly speaking, the global aspect. That when we saw it hit in Wuhan and start spreading, when we saw it spreading in East Asia, that was our chance to get ready. We should be stockpiling protective equipment. We should be ready to need these kinds of responses in the hospitals. Like, that was our chance. If you're thinking globally, you see these things coming. So in that sense, the global aspect is what comes to one place will sooner or later come to all of us. So you have to think about it on a planetary scale, because if it happens somewhere else, it will happen to us. And then once you're in the thick of it, once people are getting sick, that is a deeply local response. You're exactly right. That's a situation where it's about knowing exactly what resources you have and how you can apply those resources as effectively as possible.
How has global health as a practice done in this moment of pandemic?
It's been shocking and a little bit heartbreaking. Because on the one hand, we've done terrific research. We've produced amazing information. There is more research being done on COVID-19 than I think anything in the history of infectious disease. There's so many articles coming out daily. They're now using AI functions to synthesize it and produce summaries because there's more than anyone can stay on top of. In terms of the actual medical response, in terms of policy recommendations, Global health mobilized and did a great job. But if the purpose of global health is to guide decision makers in making good policy decisions, we completely failed. If you look at the responses almost across the board in the higher income countries, in the countries that are supposed to be powerhouses of global health skill and knowledge, all of that skill and knowledge was for what? It didn't actually guide government decision making. It isn't what influenced the policy decisions on COVID. And the pandemic just spread and spread and spread because nobody was acting on the data and the information and the recommendations that were being produced. So it was sort of the shining moment of global health where you could see exactly what we can do when we all work together. And yet, what did that add up to in terms of actually changing responses? And very, very little.